listening to the Trash Talk Fantasy Football Podcast with your hosts, Angelo Sandone, Mike Sarrat, and Mario Maniaci. Like and subscribe.
Ladies and gentlemen, I am proud to present to you Dr.Nithin of Fantasydocs on Instagram. Doc, what's happening today, man?
Hey, what's going on, Angelo? Great to be here. I'm happy to be back on the podcast and happy to talk some football.
Well, as always, we are happy to have you. So as everybody that's already listening already knows, we are in the middle of our quarterback 2019 preview, and we want to go over some injuries. We're not doctors, so we brought a doctor in for you guys to give us an expert analysis on everything that's happening. Just so you guys know, Dr. Nithin is a Division I sports doctor. We're really excited to have you, Doc. Let's just jump right into it. Let's go with our top 10. Who in the top 10 is raising questions? I know there's a lot of names like Luck and Rodgers, Cam Newton. Fill us in where we should be looking.
Yeah, so why don't we just start off with one of the easier ones who I also think has a chance to be the top one overall quarterback, and that's Andrew Luck. Good amount of people sometimes think that Luck might be injury prone just because he had back injury and then he's had a couple other things. And then over the summer in training camp, he had a calf strain. People get kind of concerned about a calf strain just because of the recent calf strain in the NBA that resulted in Achilles tear.
Durant, yes.
Yeah, and I'm here to kind of just calm that down and say that, calf strains, majority of the time are just calf strains, and there's something that can be rehabbed and rested. And a big difference is that Luck isn't out there right now playing in the NBA Finals. He's in the off season, so he's able to give that calf the rest that it needs, which is basically a couple weeks. Take some anti-inflammatory meds, rest it, and get back to throwing form. Another thing is that his position is really a lot of running around and a lot of scrambling, and he throws the ball, so he's not trying to put too much wear and tear on that calf, so I'm not really concerned about this injury at all.
Yeah, and the one thing that the Colts did that was really smart, they did the best thing for his injuries that they could. They started to put an O-line around him and give him big weapons that he could throw to quick. That line held great last year. I'm not worried about Luck, and I'm happy you actually just kind of cleared that up for me, because to me, Luck is easily a top 3 quarterback. I'm seeing him in like 5-6 spots in certain rankings, and it kind of blows my mind.
Yeah, honestly, he carried me to my championship last year. I got him off the waiver wire right around week 4 or 5 when everyone was dogging him, and I never looked back.
Hey, buy low, sell high.
Yeah, that was a great point about the O-line, by the way. I think that's really going to be impacting him this season.
I have them picked to win their division. I can't imagine anybody who's going to stop them this year. The defense is young. It's hungry. Frank Wright from Philadelphia is actually doing a fantastic job. Let's talk about Carson Wentz.
All right. Yeah, this one will probably require a little bit more of a breakdown. People are really concerned about him, and he's another person that, although his injuries were more serious, I'm still gonna take him at his draft position right now. I think it's going in the later rounds. People have a lot of questions about his fractured back,
yes.
And the thing about that is that it's called a spondylolysis, and that's actually a pretty common injury in quarterbacks. It's a stress injury of the vertebrae, and sometimes it can actually present as no symptoms at all. Sometimes it presents as back pain. The thing about it is that it doesn't require anything but rest, and that's what he's had all of the offseason. It doesn't have a huge chance of recurrence or coming back.
Well, let me ask you this question. You say you need rest. I can't imagine that a pro athlete rests too much. And
Exactly.
I see Carson Wentz. He's a big-time hunter. He's an outdoorsman. He's always out. He's always moving. He's always doing something. When you say rest for a pro athlete, is that, like taking back on the lifting, less cardio, so there's not, as much shock and things like that on the vertebrae and the spine? What kind of rest do you think Carson would need to be fully recovered?
So with the spondies, that's what they abbreviate them usually as, they basically say that the rest involves not doing activities that make the pain get aggravated. So it's as tolerated rest.
Okay.
So if he's able to run and he's not feeling pain, he's able to run. But once he starts feeling a little bit of pain, he's supposed to stop.
Well, you noticed that last year. He was not running the same way that he used to, especially when he got hurt, when he hurt his knee. Back thing scares me with Carson Wentz, I have to be honest, just because of, and I've already brought it up, is the rest factor. That guy is a baller. I mean, this kid was probably 14 years old, skipping dances at school, hooking up with the hottest girl just to read a playbook from, Peyton Manning at Tennessee. It just strikes me as that kind of guy. I can't imagine he's not going harder than he should be. I still think, though, where his ADP is, he's getting drafted towards the 10th round. I will take Carson Wentz every single time. I had a 20-person league that I drafted, did a mock draft for last week. I somehow snuck snuck him in the 12th round, and I couldn't believe
amazing.
it. I was like, you just gave me an MVP quarterback. Thank you.
Yeah, and just to touch on it again, basically, so its activity is tolerated. If you're trying to do the optimal kind of scheduling for return, you're trying to be that golden child in terms of listening to the doctor.
Right.
It's supposed to be stopping all high impact activities, including kind of jumping or high impact running or repetitive arching or rotation of the back for about 3 months, which he's at way more than 3 months.
Yeah, at this point, actually, that does sound a lot better. The injury's not scaring me from drafting him on a fantasy level there. It's just, Carson Wentz is one of those guys just because it just keeps seeming to happen with these cheap little injuries with him. And, the back's not so much a cheap injury, but, the wrist and the thumb in college or whatever it was.
Yeah.
He's got all these small little ticky-tacky type injuries, but that doesn't scare me. Behind that O-line, with that run game, with that coach, with those receivers and tight end, I'm not worried about Carson Wentz. I think I could go out there and pass for the Eagles.
And that O-line, they're being told their number one priority is not letting Carson Wentz get hit, and that's going to be their primary goal.
Yeah.
And then if you feel pretty unsafe with it, just pick up someone like Dak Prescott, who's ranked in the top 11, I think, every season he's been in the game. No one's picking him, so.
Yeah, Dak Prescott in his 3 years had a number 7, number 11, and number 10 finish. He's another one. He's not going to get you those big air raid type yards, but he's going to score you a decent amount of points when you need him. He was a number 1 quarterback for 6 weeks last year, and then it all kind of fell apart. Well, as far as fantasy anyway.
Yeah, so I would have someone, if I'm picking Carson, I'm definitely okay with picking him up. I'll probably just try and pick up some lower stash quarterback just to keep on my bench in case he does break down at some point in the season, but it's not something that I think is highly likely.
Very good.
I think the benefits outweigh the risks for him.
Absolutely, and I'm with you there 100%. Moving on here, another big name we keep getting responses about, and someone that I'm personally a little bit concerned about to an extent, is Cam Newton and his shoulder injury.
So Cam Newton had another shoulder surgery on January 24th. And they basically said that was a minor surgery. He did have a rotator cuff repair about a year before in March. So I'm thinking that it was most likely just going in there, cleaning up some scar tissue, maybe taking out a piece of cartilage that might be there interfering with stuff. They said that he's already back to throwing a football about a couple weeks ago, almost a month ago. So if it was a repeat labral tear, if it was a repeat rotator cuff tear, he still wouldn't be throwing for another 2 or 3 months.
I've
no
had
way that they're
injury.
letting him throw. Oh, nice. Yeah, so you know that the doctor's not letting you go back out there.
No, and you're not letting yourself go out and do that. That's my one small fear with Cam, that if this is more serious than they're leading on, this could be very serious because he's going to lose a lot of power in that throwing arm. And I think that still wouldn't be enough to stop him from getting on the field. And guys like Greg Olsen, guys like Christian McCaffrey, they're going to really benefit from having him needing to check down all the time. Not so much, DJ Moore and Curtis Samuels, but definitely the running back and tight end in that situation.
No, I agree with that. Definitely.
All right, you said there was one more top 10 quarterback, and I'm dying to know. It's a surprise to me too. So fill me in. Who is it?
So I would say he's on the later end of that top 10. Aaron Rodgers is who I'm talking about.
Okay.
And he's got the potential. He's always kind of ranging in and out of that top 10 depending on the season that he's in. He had some complications last season. He had a left knee injury, which they figured out was an MCL sprain just based on the kind of brace that he was wearing last season. And then they also said later on after the season that he had what's called a tibial plateau fracture, which sounds pretty scary because it's a long word in my opinion, and the long word diagnosis always sound a lot more scary than
I'm terrified and I don't even have it.
Yeah. So basically what that is it's commonly done when the leg hyperextends or bends backward a little bit, and then the lower leg bone kind of bangs against that femur and then causes a pretty significant bruise. And that bruise can be anywhere from a total fracture where there's a chunk falling off, and that's the kind of injury that JJ Watt had that knocked him out for a very long time, or it can just be a little bit of a dent. And Aaron Rodgers verbatim said he had a dent fracture in his knee. And he was playing through that last season. And if it was a J.J. Watt injury, he wouldn't be playing through that.
I think everybody's fear with Rodgers is that he is getting to the, later part of his career. Is his age playing a factor in the recovery? I think that's the common theme that I'm getting from a lot of the questions we get about Rodgers. Is his age a factor with the rehabilitation of it all?
For these things, I think he was well within the normal course of recovery for it. I think the problem with the MCL is that he never really rested it, and you're supposed to do complete rest, knee brace and extension, like basically your knee locked in extension for about 2-3 weeks, and then you should be fine. But he kept on going back out on the field, kept on taking hits, landing back on that knee. And I think that's basically what prolonged that recovery a little bit more. These injuries, they usually have a really good response from as long as they're appropriately rehabbed. There are injuries that don't do well regardless of how you treat them, but the two that he had last season weren't those injuries. And I think the offseason is really going to have a turnaround. The new head coach, I think he had a little bit lack of interest these past 2 seasons too.
Who can blame him?
So, yeah.
Yeah, who can blame him there? Well, that's good news because Aaron Rodgers is a guy that I'd love. I had him and Calvin Johnson with I think it was like the second or third championship I ever won in a keeper league, and I had them for 3 years, and I just dominated everyone. But I'm more of the grab your quarterback in the later round school of thought. I usually was, except for that year that I grabbed Rodgers. But, well, that's good news for most Rodgers owners in Dynasty. Moving on to someone who's probably not owned in Dynasty, a name that we haven't heard for a while, I'm going to kind of pull out from the grave here, Alex Smith. He had some complications with the injury, but his 2017 season was star-studded. He had a 104.5 passer rating. He became way more than a game manager. What's the outlook for him? Is he ever coming back to football?
Honestly, it's up in the air. Initially, I did not think that it would be that big of a deal because the injury he suffered, it was, I think they called it a Bridgewater injury almost, which means that it was a possible knee dislocation. So Alex Smith, he's someone who actually might not make it back, which is pretty surprising. And more of the reason why there's concern with him coming back is that infection that he had following the surgical repair. And what happens when they're repairing it is sometimes there's some bone defects or some like cracks in the bone, maybe some deformities. And if you can imagine a clean, smooth surface, it's hard to get infected. But if there's some little divots in there or little places where the bacteria
little
can
pockets,
hide,
yep.
Yeah, then that complicates things a lot. And that's what they were saying that he might have. And I think they call it osteomyelitis, which is a bone infection that needs to be treated by usually IV antibiotics, and it can be taken care of. But with the bone defects complicating it, they needed to go back in, revise that surgery, shave down bone, and it complicates the recovery significantly. So there's that part of it. And then there's part of it where he goes through all that deconditioning. He loses all that muscle mass that he has in those legs because he's not able to work them out. And then he's got an even longer road to recovery. So with someone who's as dependent as he is on his rushing ability and his scrambling and
yes, very
his mobility,
underrated. Very underrated.
Yeah, I don't foresee him coming back right now. And, I might be wrong. But if I had to put money on it, I would go towards him not coming back or him not coming back to anywhere near the same player that he was previously.
Well, you heard it here, folks. You got him in Dynasty. You got him in a keeper league. For some reason, he's still sitting on your bench. You got to cut ties. Another guy, actually funny enough, who I believe got hurt the same week as Alex Smith is Jimmy Garoppolo. Jimmy Garoppolo got signed to a big contract. We know that Belichick did not want to get rid of him. That was actually a big fight in the front office with him and Robert Kraft. He didn't want to let him go. He knew he was the guy. He had played some games a few years prior. They just missed the playoffs, things like that. What is the outlook on Jimmy Garoppolo? I know he was throwing since April. Just give us a little insight. I love him as a sleeper. If he's there, would you feel confident drafting, with his injury, would you feel confident drafting Jimmy Garoppolo in the 12th to 13th round?
So the 12th or 13th round, I would feel confident drafting him there. Reasoning is because if you listen to any other of my podcasts or you look at my posts on Fantasydocs, you'll see that I usually steer away from players that are 1 year out from an ACL injury. With a couple exceptions. And one of those is if they're a rushing back or a quarterback who doesn't do too much rushing or rely too much on their mobility, because the ACL, it's in the knee, obviously, and that's going to impact cutting, speed, stuff like that. Whereas a quarterback, they're trying to just survey the field and make the right throw. And looking at how many rushing yards Jimmy Garoppolo's had in 3 years, it looks like.
Yeah, he learned from Tom Brady,
So, I'm not too concerned about it. He's a year out from his ACL injury, and it's about a year recovery from that ACL if you're not trying to be a running back or a wide receiver or a tight end.
And let's just hope that line can protect him, because I think Garoppolo could be a monstrous guy. To me, I would pick him in a 12-person standard league. 4 points per touchdown, 6 points per touchdown, doesn't matter. I would take him as my solo quarterback now that he's got the stamp of approval from you, Doc. I feel good about it.
Yeah, definitely in that 12th or 13th round, because, what are you really losing there?
Yeah, exactly. And if you could pair that up, we were talking before the show about if you were to grab Carson Wentz, we're really high on him, grabbing a guy like Dak Prescott, grabbing, another guy a few rounds later. that would be a perfect pair. I really think that if you drafted Carson Wentz in the, let's say, 9th to 10th round and Jimmy Garoppolo in the 12th to 13th, you have a dynamic duo at quarterback.
I agree. Great strategy.
One last question, Doc, 'cause I don't want to hold you up too long. With so many older quarterbacks in the league, we have this huge young wave, but we're not going to talk about these reliable, old faithful type guys such as Big Ben, Brady, Brees, Rivers, Manning. There are a couple dynasty owners that reached out to me who have Big Ben and Brady, and they said, is there anything we should be looking for in training camp that should be a telltale sign that they're hampering from an injury or they're weak in a certain area? What's the kind of stuff that you're looking for with these older QBs?
I'm not looking at too much with Big Ben, honestly, because he's a Neanderthal, let's be honest.
Absolutely.
He's someone who just picks up his club or picks up his football and just throws the rock, and he's not going to let anyone stop him from doing that. He had some rib injuries last year, and he played through it. He got hit a bunch, and he just got right back up. He's a big guy, and I'm not too worried about him getting injured enough to throw him out of the season, unless it's a freak accident like an ACL on a planted foot, something that would have happened to a younger player too. Ben's age isn't concerning me at this time.
On one hand, you have Big Ben and the Neanderthal. Let's go to somebody who's maybe the polar opposite, like a Drew Brees. We see Taysom Hill come in. We see him throwing. There was a couple plays last year where you would see Drew Brees throw a deep ball to Michael Thomas or Traquan Smith, and it didn't just quite have enough juice on it, and then they would bring in Hill and try the same exact play or maybe do an RPO off of that same formation. Are you worried about Drew Brees at all moving forward?
I am a little bit, and I'll just kind of reference Broncos Super Bowl year, and that was Peyton Manning, and he was surgical in his throws, and he was still making them, but they weren't at all tight. They were spiraling. They were kind of ducks, and the defense carried him through, and that was clearly a steep drop off.
Yep.
And I think that Drew Brees is reaching that time where he's still got all the stuff up there, but that arm and that kind of physical health is deteriorating a little bit. He's a 40-year-old quarterback in the NFL, and there's not too many of those.
Yeah, it's really impressive the way that sports medicine has come along over the last 20 years. You never had quarterbacks playing this late in their career. No. I can't think of any, at least. Maybe that's something we should look up for one of our next conversations. So outside of the other remaining names, is there anything that's like notable or newsworthy with Tom Brady, Phillip Rivers, or Eli Manning?
No, I mean, there's never really too much notable about Eli Manning, let's be honest.
Hey, I'll tell you what, for many years, he was a late quarterback drafter's dream scenario. He was a guy who was top 10. He was Dak Prescott, essentially. Yeah. You're like, I feel safe, but I know I don't have to draft you till around 10 or later.
Yeah. Or he was like a Blake Bortles, except with a couple more Super Bowl rings than Bortles. Bortles was a fantasy god for a little while.
That is actually a great comparison between two quarterbacks. That's kind of crazy. And I don't mean to knock Eli. I know that I'm a Cowboys fan, and I'm just a little snarky. They beat us in 2000 and I think it was the 2008 season. Tony Romo threw a pick that Patrick Creighton should have had, and Eli has like this just goofy look on his face, and he had nothing to do with the win. It gets on my nerves. Yeah, it was 2008 when they won the Super Bowl. Yeah, that was their first one. All right, Doc. Well, I thank you so much for your time. Everybody, take a second out of your day and go ahead on Instagram and follow at Fantasydocs. Dr. Nithin is the man. He gives us the best advice. You can reach out to him at any time, and the same with us. Doc, do you have anything else to say to the people?
No, just keep tuning in, everyone, and thanks a lot for having me on.
You are now listening to the Trash Talk Fantasy Football Podcast with your hosts, Angelo Sandone, Mike Saraf, and Mario Maniaci. Like and subscribe, motherfuckers.